Welcome once again to Stay Alive with Church Alive. And this is your host and president of Church Alive Development Corporation and also the proud pastor of Church Alive Community Church. And we're here today, as usual, to bring you a holistic approach to the needs of God's people. And as a result of that, we're looking at the health conditions of the Bronx, and not only of the Bronx, but of the city of New York. Well, we are going to address our attention in this program to the Bronx, thanks to Bronx Health REACH, which is an organization that we have been working with for many, many years, doing great work in advocating on many different levels. But now, specifically in this program, we're going to talk about healthy children and healthy families. And to do that, we have two of the staff people of Bronx Health REACH, and that is Emily Oppenheimer. Okay, got it right. Second time better. And also we have Yolanda Benitez.
Yes.
Now, we've known Bronx Health REACH, and they keep expanding, by the way, in all different areas, and we try to keep abreast with them. And so this program is important because it's right there in the most needy area, and that is health of our children, and at the same time, the health of our families. Tell us about the program, and also tell us a little bit about Bronx Health REACH.
So
that is Emily.
You said it right, Bishop Birkett, that children are such an important emphasis for public health programs because they have their entire lives ahead of them. And if we can work with children to build healthy habits, then they will carry those healthy habits with them for the rest of their lives. So this program came out of a need to address healthy eating, active living among children and their families in the Bronx. And Bronx Health REACH has a long history of working with faith-based organizations as well as other partners in the Bronx. We are a community coalition. We are a program of the Institute for Family Health, and we work with over 70 different organizations in the Bronx to end racial ethnic health disparities.
Well, we're going to really get into exactly this very special, unique program. And I want to Yolanda to tell us a little bit about it from your perspective.
Oh, absolutely. So I'm the program assistant for Healthy Children, Healthy Family. And this is a great program because it is unique because it teaches the children and the parents together how to eat healthy and how to engage in physical activities, to do exercise. This program is really fun. Both children and the parents really enjoy it. They go home and they have so much fun. It's an 8-week workshop for this program.
Right.
And each week is a different faith and nutrition theme. And then the last part of it, we have partnered with our Kings of the Game. So they provide coaches to come to the faith-based organizations and teach the children and the parent how to engage in physical activities together, and they make it really fun. They have music, they have props, so it's a really fun time for the parents and the children.
This is great. How can people get involved, Yolanda?
Yes, great question. So to get involved, it will have to be a faith-based organization in the Bronx, and they will have to need a solid group of children ages 8 to 12, and at least one caretaker or caregiver or parent to be involved in the workshop, because again, the whole emphasis is to teach children and parents how to eat healthy.
Is there an age group that this particular program wants to lock into?
Yes, ages 8 to 12.
8 to 12, okay. Can you add something to that in the area of operations?
Yeah, so we are optimizing this work, and so that we ask any faith-based organization who's interested in working with us to have a group of at least 20 children and parents or families that can work with us. And then, as we've been saying, the children are ages 8 to 12.
Okay, I'm going to back up a little bit because we didn't do our audience justice by allowing you to share with them about the Institution for Family Health, okay?
Well, I'd love to. The Institute for Family Health is a network of federally qualified health centers in New York City and New York State. We work to serve the medically underserved and ensure that all people who need health care have access to it. And our work expands beyond a clinical setting. We also work in communities, we work in research and training. And so our work with Bronx Health REACH, a program of the Institute for Family Health, we work specifically with communities in the Bronx. So as I've been saying earlier, all of our work comes from our partners. We're a coalition of over 70 members, and that includes advocates, that includes schools, that includes other healthcare organizations, that includes faith-based organizations. And so we have a history, as you said, Bishop Birkett, of over 20 years. Actually, this is our 20th anniversary year.
Right. Well, you do a lot of networking. I can see that.
Yes,
yes. Housing, you and your faith-based organization, research institutions and whatnot, to be able
Yes.
to gather information for the programs that you are going to conduct. Am I correct?
Absolutely. Yes. So it's very important in all of our work that we evaluate and we understand the impact of all of our work. So for this program, we partner with New York University School of Medicine on the evaluation.
Now, Yolanda, this program isn't brand new. It's been operating prior to this year, 2019. Tell us about the success of it and how it's working so far.
Oh, we had a great first year. So 2018, we ran the program with 8 churches, and one group was in the summer, one group was in the fall, and it was really fun doing the program, outreaching to partners that we had strong connections with before and making new partnerships. For example, we worked for the first time with St. Jerome Hand Community Center, and they ran the program. So that's what we did in 2018.
Okay, now we're talking about who can be a part of this. And I know we talked a little bit about earlier, but we want to really let people know that they can get involved. It's not difficult. As a matter of fact, it's worthy to do this. Okay.
Yeah.
Now, before I ask you that answer question, explain healthy children and healthy families, and that's Emily.
Healthy Children, Healthy Families is an 8-week program. We work with faith-based organizations across the Bronx to teach these workshops. It's a train-the-trainer model, which means we work with the faith-based organization to identify 2 leaders who will actually teach those 8-week workshops with children and families.
Now the question is, can any organization be involved, and whether or not that organization is going to get support? Because a lot of people would like to do things, but they're strapped, and the church is always called upon to do more and more, and then we wonder, how can we do it all? Is there any assistance in this program? And then I would like you to just give some examples of how it's operating in other organizations, what they're doing, because we're going to be looking at pictures as we talk about different organizations, what they're doing. But I want to share with them the support for family health and healthy children. Healthy children and healthy families.
Oh, absolutely. So yes, we partner with the churches, and there is a financial benefit for the PF coordinators, or the church leaders, I should say, who are going to be trained and teaching the workshops. And we also have fun prizes for the children and the parents who participate.
Also, this is really more of a fun situation and excitement for everybody to get involved and whatnot. And right now we have a lot of families that are watching, and they're saying, I like my children to be involved in it. They can call you and you can identify one of these locations where that family can get their children involved. Is that right? In other words, they can call into the same number, and you can connect them. I see a list of real wonderful organizations, which one of them I know that are really doing a great job, and it might be around the corner from somebody who has a family and want their children to be involved in that. Can you do that?
Yeah, absolutely. If you are a family at home who's interested in participating in this program, please be in touch. We absolutely can connect you to another faith-based organization that's running the program. Similarly, if you are a faith-based organization or know of a faith-based organization who might be interested in working on this program, please be in touch as well. We can talk to you about both options, and we'd love to talk.
Okay, now the question is, first, how many people in each project, optimally, that you would like? In other words, how many children and how many family members? I know you have a certain number that you'd like to work with, okay? We're going to let Emily, and then I want you to, to get in on this answer, okay?
We ideally would like to work with a group of at least 20 children and their family members. Mm-hmm. And the reason being that we want to optimize the reach of this project. We want to expand as far as we can. And so we want to make sure that when we're running this program with our faith-based partners, that we're reaching a large audience of children and families who want to learn about the healthy eating, active living.
Okay. Do you want to add anything to that, or did she cover it all?
She covered it all.
Okay. All right. Now, I know my church is going to get involved, just giving you an idea how we're going to do it. And I spoke to my wife about it. I said, we'd like to be involved, but we don't have a lot of children in our church because we deal with a lot of seniors, and we have a more passionate ministry towards the elderly. And I said, well, how are we going to do it? She said, well, we have a mission. And at the mission, we give out bags of food almost every day. And the families come to the mission, and they usually bring all the children with them. And we give them clothing, and we get to know them, and we get to be more holistic in their needs, not just food. Well, how can we give you other information, resources, and services? And so we're going to also work with the same families with a local school. And because the local school, what they do, they refer needy families to us, whether a child comes to school and doesn't have a coat, or whether there's a situation where the family is going through some kind of crisis, then they send them to the mission, and we work with them that way. So what we're going to do, we're going to have after-school program. So after school, when the parents come to pick up their children, we're going to ask them to stay back for an hour and a half, and we're going to get them involved. And that's how we're going to do it at Church Alive, just as a way of encouraging you that it can be done. And God always has a way when it comes to meeting the needs of his people. Now, what are other churches doing and organizations? How are they operating? You want to share with us?
Sure. So I was actually going to ask, do you need any flyers for that?
Oh, definitely. We're working. Matter of fact, we had a very special friend out of Bronx Health REACH, and her name is Maranta. And she's just a wonderful person. Lost a lot of weight, but she's a really wonderful person. And she has really blended into our ministry. We work with her with the Buck program, and it's been very successful. A lot of our seniors have been blessed through Bronx Health REACH, and they were able to get nutritional food and whatnot like that. So we've talked to her and working in that area, and she finally got us encouraged to be part of this part of it.
Well,
right,
thank you, Immaculata Maranta.
But there are other churches that are doing it. We want to share a little bit about some of the other churches last year.
Yeah. So what's nice about this program is that we do provide some flexibility. So there were some churches that would run the program during Sunday school and then as part of services. Other churches ran the program on Saturdays because that was the most convenient time. There were others that do it in the evenings at the end of the school and work day. So they've really worked with their congregations and their families that are signed up for the program to ensure that they're holding it at a convenient time for everyone who wants to be a part of this.
Well, this is great. All right. I also want to mention that if you're out there and you may know of a church or an organization that would definitely like to do this, and we don't know about that organization, then there is an incentive program for you to do that. So you can usually call Bronx Health REACH, and the numbers will come up on the screen, and they'll tell you all about that special incentive program. Yes. And I think that many times, we'll pass a daycare center, or we get to know the people in the daycare center. So or after-school program, and they would really, they're looking for programs like this, but they just don't know where it is. And you pass by those doors and pass by those organizations almost every day. That organization should know about healthy children, healthy families. All right. So we're asking you out there to be ambassadors for us to make sure this spreads out as far as we can get it to reach the needy families in our community. All right. We would like to give Yolanda a chance to discuss the operational procedures once again. I want to try to go it step by step, and so they can really understand what it is to get involved, what will it take, the supports that are there, how many children, and how many parents. Go ahead.
Okay, great. So if you a church in the Bronx or a faith-based organization who is ready to do the program now, we will start one session in the spring. So in March, we will start the trainings with the church leaders, and then in April, we will start the program. So that is our spring session. To be part of Healthy Children, Healthy Family is very basic requirements. So it has to be a faith-based organization in the Bronx and have a solid group, about 20 children and a caregiver. And the age group has to be between 8 and 12.
8 and 12. And what is the duration of the program?
It's 8 workshops. Each workshop is an hour and a half. And because it is a partnership, there is flexibility, and the church decides the time and day they'll host the workshops.
Exactly. Now, Emily, there are some activities at these workshops. They're not just workshops, boring workshops. Okay, we want people to know they're exciting workshops. Tell us what happens at these workshops.
They are. These workshops are a lot of fun. The time goes by so fast. So there is a nutrition topic that's covered with the leaders of the church, with the children and the parents. It's a very hands-on topic. It's tied to a scripture, and it allows for the children and the parents to really discuss and have fun with what that topic is. So it might be making a snack that's relevant to the topic, or it might be creating a drawing or a piece of art that's related to that topic. We want to make sure that it's fun. And then the second half, after the nutrition piece, we have that final 30 minutes of fitness, which is also a lot of fun, and that's taught by a coach through Kids in the Game. And so what's very unique about that is that it's really adapted to work with a child and the parent and make exercise fun.
Okay, now we like to talk about incentives. Okay, because a lot of people want to do things, but they have to make sacrifices to do them. Taking off work or having to get a babysitter or do something, but time is money. Okay, and even though we love to have volunteers, nowadays it's hard for people to volunteer because it's somewhat expensive. How does this program deal with that as far as stipends and things like that? You want to explain that?
I'd love to. So this program recognizes that people have time and they have limitations. As far as a church implementing this program, we don't want financial concerns to be a barrier, and we do provide a grant to a church or a faith-based organization running the program. Additionally, part of that funding would go to the teachers, the leaders of the church who are teaching the program. And then for the parents and the children who are putting their time into being part of the program, we have a prize and incentive each week. They are surprises, but I think they're pretty good. So
right. So each one is a surprise. So they got to go to the next meeting next week.
Yes.
Well, we need that because we have needy families in our communities. No question about it. And any little thing that would make their lives more joyful, happier, then that's what we ought to do. We have to consider that. I know because we have the families that come to get their food packages. And sometimes we'll put a little toy in there, a little book in there, or a movie And so they're not just getting food. When they get home, they can put a video on and watch the story of Christ. At the same time, enjoy the food that we've given them. And so it's a holistic approach. And I'm glad that the Bronx Health REACH has taken that same approach. Not just have workshops that people say, well, I've been to it, I have it, I don't want to go back because it was boring.
Yeah.
No,
Yeah.
you can come back because something better for the next week, and there's another treat like that. And like you said, we need to have fun
Yes.
in doing what we want to do, okay? Yolanda, we want to say something about the area and what you've seen in these workshops and how the responses have been.
Yes. So last year I was there for a lot of the workshops. Then I got to witness how the parents were really engaged in the nutrition content. They walk away feeling more knowledgeable within themselves. Like they have like parents get together and talk about ways that can cook healthier for next week. The kids have a lot of fun, especially the fitness program. They really, really love the coaches. They connect with them. They do different physical activities. So it is a very fun workshop.
Right.
And the time goes by really fast.
Very good.
Yeah.
Well, after the workshops, is there material for them to take home? Is there material for them to practice what it is to eat? Is there material that can be left at the churches for people who are not in that group, but we could share that information with others? Is it?
Yes. Part of what Bronx Health REACH provides in this partnership and running the program are all the resources and materials to run this program. So every parent and every child gets a workbook. And that has all the nutrition information that's covered in these workshops. And that allows them to follow along in the workshops. And it also allows them to have a reference if they want to go back at a later point and research.
Right. Results. Everyone wants to know, how is it working? Is it working well? It must be, because you're going into your second year. That automatically
Yes.
tells you that you have satisfied your granting. But we want to tell you, where does the funding come from? While we're talking about that part, and so we can accommodate those who want to know, where does the funding come from, and then we are going to close by last comments that you might have to say to organizations that are out there. Okay? Where does the funding come from?
Oh, the funding comes from the federal government. It's the Office of Minority Health. And this is a larger grant, and it's given to 15 other sites across the country. We are the only site in New York City. And so we are really honored and feel, as stewards of taxpayer dollars, that we want to make sure that this program is reaching as many people as possible. And so we're so grateful to have the opportunity to talk to you about this today.
Well, I'm glad you mentioned that, because this television show goes into Manhattan, Brooklyn, Queens, Staten Island, and Westchester. Are you just for the Bronx now?
That's a really good question. So this particular project at this point in time is only for the Bronx. The Institute for Family Health does have health centers across New York City, and we can refer you to our website and connect you if you're in another borough and would like to connect with us.
Okay, now we come to the last few minutes. What would you like to say to this audience, and to let them know they can come, you're there, you answer questions for them, you'll get them involved, and you'll give them all the support. What would you like to say to them? We'll give you a minute and a half, just to say to this audience how important it is for them to consider the health of children and the health of families. And we'll start with Emily.
We know that healthy behaviors are adopted very early in life. We also know how influential parents and families are in children's health. And we feel that this program is so important in building a healthier Bronx and healthier communities. It is so much fun, it's so positive, and we are really excited to be able to share this with more folks around the Bronx. And so if you are interested in working with us, whether you're a family or you are a faith-based organization, please get in touch. We're going to share our contact information on the screen, and we'd love to work with you.
Yes, would you like to share?
Yes, so I feel very honored to be part of this program, Healthy Children, Healthy Family. I myself a Bronxite. I'm born and raised here in the Bronx, and growing up, I didn't have access to a program like this, and this is so unique because it brings the family together, something that it is changing within our communities, and it is important to learn as a family unit about healthy eating so they can have this great benefits for the rest of their lives. So this is a great program. It is fun, and it's something that is really needed in the community.
Thank you so much. I want to give a note of credibility and really a note of dedication to Charmaine Riddick, who is the director in our 20 years of really doing this fine work to make a difference in the lives of not only the Bronx, but in how Bronx affect other areas and throughout the city of New York. And we also want to give a note of thanks to Minister Joseph Ellis, who does a lot of the outreach work, and I know he makes sure that I get all the messages and get all the flyers and get all the information, and he's relentless on that. So I want to give a shout out to Minister Joseph Ellis. But going back to Charmaine Riddick, and a dedicated person to making the difference in the needs of people physically and advocating for those who are mistreated in hospital, medical care, and all of the wonderful programs that she has administered to that are making a difference every day in the lives of people, especially in the Bronx. So we want to thank you, our audience too, for allowing us to come into your homes. Once again, I hope we've brought quality information, resources, and services to you that have improved your lifestyle and have given you an opportunity to do better and be more healthy. We want to ask you to spread this information to your neighbors, friends, other nonprofit organizations that may not be watching, churches and ministries that are involved. And if you're watching this program and you know of a program out there that's really doing this work and would like to get the assistance to expand it, then the telephone numbers are coming up, and let them know that they were referred and by yours truly, Reverend Dr. Birkett. God bless.